Hi, this is Dr. Jeff Nelson, your Utah Wellness Doctor with Freedom Healthcare, and today I want to talk about how we can improve our energy. I get this complaint a lot. Patients come in and just say, I just don't have energy anymore. And so I want to go over a few things that can increase and decrease our energy and some of the over-the-counter supplements that are out there that may help, some of the lifestyle changes that can help with that, and then also some of the other things that here at Freedom Healthcare we can help you with when you're doing everything you can and nothing seems to work. So first of all, stress. Stress is a big energy zapper. And all of us have it. We've got work, we've got kids, we've got school stuff, we've got more work stuff, we've got family stuff, yard work, everything. And then on top of that, throw a COVID pandemic. It just makes you feel even more stressed. So stress is a big thing that all of us are dealing with. One of the things that we get into this pattern and we forget to take care of ourselves. So what I try to tell my patients is take a few minutes, at least 2 times a day, to just stop and enjoy the world around you, enjoy the nature. And everybody has different things they like to do. I mean, you could stop and take a 5-minute walk on a break from work. You could stop and just rest and enjoy the mountains or watch the birds. You can take a few minutes to do some deep breathing exercises or incorporate yoga into your lifestyle. But what we need to do is find ways to stop, pause, take a time out from the stress of life and just relax. If we don't do this, our adrenal glands start to crank out cortisol all day long. And then, eventually everybody has heard the term adrenal fatigue. And that's when your adrenal glands are just they're cranking out cortisol all day long to try and give you energy, and eventually they just peter out and they just can't handle it anymore, and then you get even more fatigued. Cortisol is supposed to go up in the morning. It's the stress hormone. It's supposed to go up in the morning so we can get up and get going on our day, and then after about 9-10 a.m. it takes a downward turn. By about 5-6-7 p.m. it's supposed to be really low so we can wind down, physically and mentally relax, and so we can sleep at night. Next thing is sleep. A lot of us, me included, we stay up way too late and we don't get enough sleep. We should really be trying to get 8 hours of good sleep per night. And a few things that can affect this, obviously the stress, and if our cortisol levels are sky high at nighttime, we're not going to be able to physically and mentally wind down and relax. A couple of other things that really mess up our sleep. Screen time at night. And if you don't believe me, ask my wife because she gets after me for this, and she's right. Screen time, TV, too late at night, and especially the phones. Even just a little buzz of the phone can cause our nervous system subconsciously to just kick that epinephrine in and get us going. So try to get the screens out of the bedroom and reduce screen time at night. A couple of things that help with sleep. There's over-the-counter things that can help. Vitamin D is good at helping us de-stress mentally and also physically. It reduces inflammation in our bodies, and it really has a lot of psychiatric benefits. So it can reduce anxiety quite a bit. Melatonin is another thing that's used commonly. A lot of people use 1 to 2 milligrams of melatonin, and oftentimes it's not enough. I find that most people seem to need around 5 to 10. If you feel like 10 is not even doing anything for you and you think you need to go higher, I'd recommend coming in and consulting with a physician about higher doses. They're safe, they're effective, but we can help you figure out which dose is right for you. Melatonin is one of the most powerful antioxidants out there. It reduces cancer, it's good for mood, and it reduces cortisol and helps us relax. Another thing that can just take all of the energy out of us is our diet. One of the most common complaints I get from patients is that they've been told they're hypoglycemic. Their blood sugar is crashing and they're just exhausted. And it's incredibly rare to find a true pathologic hypoglycemic patient. That would take a tumor that's growing, that's creating way too much insulin, and that is one of the most rare things you'll find in medicine. And I've yet to find one of my patients coming in with that real cause of hypoglycemia. But what happens we get exhausted and our body it wants energy. So it craves rapid, highly accessible energy through our diet. And that comes from high glycemic index carbs, sugars, sugar substitutes. We find those in sodas, candy. Even we could crave like just juice, like high concentrated apple juice and things like that are really high in sugars. So when our body gets exhausted, we crave these high glycemic index carbs, we give them to ourselves, and our sugar shoots sky high. Well, that helps for a bit, but then our body's reaction is to get that sugar into our cells. So our body creates a ton of insulin, and that overproduction of insulin can cause us to be fatigued and feel kind of foggy thinking, and then that causes the sugar to crash and overreact. So we do get hypoglycemic, but it was all self-induced. So my two most basic diet suggestions for anyone and everyone. Number one, get rid of the sugars, the sugar substitutes. Whatever your biggest offending agent is, try to get that one out first, and then keep looking and try and reduce it throughout your whole diet. I mean, you can get all the way down as nitpicky as the kind of peanut butter you buy. A lot of them have sugar in them or high fructose corn syrup, and some have peanuts, period, and that's it. And so you can even try to reduce the sugars in all the foods you buy. So number one, get rid of sugars, get rid of sweeteners. And number two, every time you eat, ask yourself, where's my protein? So if I eat a banana, my blood sugar is going to spike higher and then crash lower than if I eat a banana with a handful of almonds. When I have that protein there, I'm going to get a more steady, reasonable level of blood sugar, and I won't have that crash at the end. Okay, and I guess a third recommendation was try to move away from processed foods and go to more whole foods. The more processed foods we get, the more inflamed our body gets, and that just zaps our energy. Other than obviously the bad stuff too, causing cardiovascular disease, psychiatric diseases. So processed foods just will reduce our energy overall. Another thing we can do, exercise. I recommend 30 to 60 minutes of exercise a day, and I'm not pointing fingers because I need to work on this too. But if we can take a break from our life and get physical exercise of 30 to 60 minutes per day, that could really help us control those cortisol levels. It really helps us de-stress and go to sleep at night, and it improves our diet as far as weight loss. Now, I get patients coming into me all the time who are usually in their 30s to 40s, and they say, Doc, I'm doing all that stuff and it's not working. I'm exhausted, I'm gaining weight, I'm tired, I don't sleep well, I've got insomnia, I've got anxiety. A lot of times women talk about feeling cold all the time, losing hair faster than they ever have in their lives. And so when you're in this 30 to 40 year range, what you got to understand is our bodies are aging and our hormones are just starting to go down. Everybody's hormones take a downward turn as we age. And these are the natural hormones that are good for us. And as we age and these hormones go down, our body's metabolic rate goes down, so we gain fat. Our anxiety goes up, our sleep is worse, and all these other symptoms, as well as increasing the risk for high blood pressure, heart disease, strokes, heart attacks, and those things. So let's talk about bioidentical hormones. Bioidentical hormones meaning the same hormones that our bodies make, not synthetic, chemically altered medication hormones, but bioidentical. So the same thyroid that our body makes, not a synthetic thyroid, but the same one we make, and the same testosterone, the same estrogen, progesterone, etc. So let's go over a few of these. Number one, DHEA, that's dehydroepiandrosterone. That's a hormone produced by our adrenal glands, and those sit right back on top of our kidneys. Now, DHEA, interestingly, peaks out at about age 25 and then just keeps going down as we age. And the two biggest things that DHEA does is drive our metabolic rate, so help us burn energy and lose fat and reduce diabetes, and boost our immune system. Now, DHEA has a lot of other effects. One of the other biggest ones would be psychiatric benefits. Most of the studies show reduced anxiety and depression. But DHEA has an effect on all of these, and improves our efforts in all of these. Let's talk quick about thyroid. Everybody's thyroid takes a downward turn after about age 30 to 35. Women are often more sensitive to the drops in thyroid than men are. Most women will come and complain about thyroid symptoms in their mid-30s, most men mid-40s to mid-50s. But we're all going to feel it eventually. And thyroid is a big driver of energy, enjoyment of life, metabolic rate, fat burning, and it also controls our body temperature. And it's one of the major causes of hair loss in women is low thyroid. So next on my list I want to talk about after thyroid is testosterone. Testosterone is a hormone that's important for both men and women. Most women think that's a man's hormone, but women's ovaries make testosterone. In fact, when a woman is in her peak health years of her life from 20 to 30, she makes more testosterone per month than estrogen. Most doctors don't even realize this, but it's actually the case. So testosterone is actually a de-stressor. A lot of people think testosterone causes rage, but it's actually calming and relaxing, unless you go crazy high levels of it, which is not advised. But testosterone at normal, natural levels reduces stress, improves sleep, it improves our mood, our energy, and our exercise tolerance and recovery. Testosterone helps us retain muscle and burn fat. So testosterone is a very important bioidentical hormone to improve our energy. Next one, estradiol. Estradiol is both a men's and women's hormone. A lot of men think that's just for women, but no, we need it as men. We get it from our testosterone. It converts into estradiol. And estradiol for men and women is, every study to date, one of the best fat burners there is. It reduces breast cancer. It improves cognitive function and mood and energy. And it improves sleep by reducing insomnia. So estradiol is important for everyone. Progesterone, this is one that's women only. And progesterone, interestingly, in women will go down at around age 30 to 35 to 40, but estrogen holds on strong. And so when a woman loses her progesterone, a few things happen. Skin, hair, nails, all gets a little worse. Progesterone in every study to date burns fat and reduces diabetes. So when women lose progesterone, they start to gain fat, and they just can't figure out why. They're doing everything they can and none of it's working. And progesterone is one of the absolute best things a woman can take to help sleep and reduce anxiety. So these are just a few examples of bioidentical hormones and how they help us reach our goals in all these areas and improve our energy. If you have any questions about supplements that you ought to be taking, what doses are right for you, or if you think maybe your hormones are off because you're doing everything you can and it's just not getting the results you used to get, come on into Freedom Healthcare. We can talk about these things with you. We understand functional medicine, supplement usage, and we know how to measure hormones and reach optimal, normal human levels of bioidentical hormones that only improve health and reduce disease. So if you have any questions, give us a call.